Hi, everyone. Thanks so much for joining us this afternoon. My name is Sarah Miller. I'm the Executive Director of the American Economic Liberties Project. We're an organization that is focused on pushing policymakers, supporting policymakers in confronting concentrated corporate power and decentralizing power back to working people, back to smaller businesses, and back to communities. Thanks so much for joining us today. I want to thank our partner for this event, People's Action, and I also want to thank Zephyr Teach Out, whose book, Break 'em Up, has inspired this series. This is the second in our Break 'em Up series. The first focused on worker power. This one today will focus on concentration, corporate power in the healthcare industry. I think one thing that we see is that whether you're looking at hospitals, at insurers, at pharmaceutical companies, at medical supply companies, concentration in the healthcare industry is systemic. It has been allowed and promoted in some cases by policymakers, by regulators for decades, and it's reached a crisis point. That's particularly evident in the context of COVID-19, where corporate concentration and its effects have been kind of laid bare, I think, for all to see. The impact has been especially severe and disproportionately severe for communities of color, and that's directly related to corporate concentration in itself. Corporate power in the healthcare sector harms patient outcomes, it harms worker pay for healthcare workers, and it harms public health outcomes for communities too. So we're going to dive into all of this today. I just want to say that we're also incredibly inspired that we're at a turning point where we can start to chip away and attack the deep-rooted concentration within the healthcare industry and hopefully help to deliver better outcomes on all of these fronts in the coming months and years. And to that note, I'm so thrilled and honored to be able to introduce our keynote speaker today, Congresswoman Cori Bush. Congresswoman Cori Bush is from Missouri, 1st District. She is a nurse. She is an activist. She's the first Black woman elected to represent Missouri. And within just a few months in Congress, she has led on so many issues, including this one. She's a strong proponent of Medicare for all. She has introduced sweeping legislation that would cap pharmaceutical prices. And just last week, we were so thrilled to see her join an effort led by Katie Porter alongside a number of other senators to call on the Federal Trade Commission to investigate monopolization within the pharmaceutical industry. So we are so grateful for her leadership. We're so grateful for her time with us today. And with that, I will turn over the floor to Congresswoman Bush. Thank you so much.
Hello, everyone, and thank you. Again, I'm Congresswoman Cori Bush, and I represent St. Louis as the U.S. Representative for Missouri's 1st Congressional District. I'm so honored to be in this position, and sending a shout out to Zephyr Teach Out for the book, and to Morgan Harper for the work that you've continued to do since your since what you were doing before. And thank you so much to the American Economic Liberties Project for holding this Break 'em Up series. With the nomination of progressives to the Federal Trade Commission and a social movement led by labor organizers in big tech, the time is now to launch a corporate power revolution. And I'm honored to have been invited to speak on these important issues. I have the honor and privilege of representing Missouri's 1st in Congress, the district where I was born and raised. I'm also a nurse, an activist, organizer, a pastor, and I'm a single mother. And up until a few months ago, I was uninsured. I spent months without health insurance while I was running for Congress as I battled COVID-19 and was hospitalized for pneumonia. I'm intimately aware of how fundamentally unjust our healthcare system has become, both as a patient who has been saddled with medical debt and as a nurse who has seen patients refuse care and die because they could not afford to pay their treatment. And if you don't know what that's like, the patient shows up, I triage them. I say, you need to go to the hospital because the pain that you're having, we want to rule out a heart attack. And the patient says, I don't want to go to the emergency room because I can't afford it. We have a healthcare system that ties medical insurance to employment in the midst of a pandemic where unemployment levels have reached record highs. What we need, and what advocates have demanded time and time again, is a system of care that guarantees health and medical services to all, a system that prioritizes people over profits, humanity over greed, and compassion over exploitation. We need to put the care back in healthcare. And when a handful of hospitals, pharmaceutical, and insurance companies control the fate of our system of care, we have a problem. That's why I'm fighting for health justice. That's why I'm fighting for Medicare for all. It's why I'm fighting to rein in corporate power and lower the cost of life-saving prescriptions, medications. What many do not realize is that dismantling corporate monopoly power is a racial justice issue, because it's these mega corporations that determine who has access to the best medication and who is left to suffer alone. They determine who has access to quality hospitals, health centers, pharmacies, and who is left to rely on the emergency room for routine medical care, which I have done in the past. In St. Louis and in other predominantly Black and Brown communities across the country, we've seen pharmacies consolidate so much that many areas are left without nothing more than a CVS and a Walgreens as their only options, as independent pharmacies have been forced to shut their doors, no longer able to afford to serve the communities they know and love directly. This, despite the fact that independent pharmacies have been shown to treat their workers better, so much better, and deliver personalized care and be much faster at distributing COVID-19 vaccines. Reports have also found that CVS and Walgreens charge more than 8 times the amount, eight times the amount that independent pharmacies do for the same basket of drugs. It's not just an issue of pharmacies, though. We see the same exact thing happening with hospital consolidation. As hospitals close their doors and patients are left with fewer and fewer options to choose from, they face higher costs for medical care, lower quality care, and worse outcomes. And let's be clear about what's going on. All of this is happening in the midst of a global health catastrophe that has hit Black and Brown communities especially hard. Racism and anti-Blackness takes on many forms. Racism is over-policing and underinvesting in our communities. Racism is also also exploitation and health inequity in our communities. Racism is healthcare deserts that leave too many people struggling with substance use disorders and mental health issues behind. Rather than reforming our healthcare system to ensure that our communities get the care we need, we instead rely on private prisons and jails to provide mental health, social services, and medical care to our folks. Rather than guaranteeing health care to all, we've let corporate monopolies make treatment unaffordable, forcing people to forego their medications altogether. Rather than treat issues like substance use disorders with a healthcare system rooted in compassion, we criminalize them. That's part of the reason that in part of my district, St. Louis County, we've seen opioid-related deaths jump 47% for Black men alone. It is because of this that already within my first 3 months in Congress, still haven't crossed that 3-month line, I joined Senator Sanders in introducing a package of prescription drug legislation to rein in big pharma and make prescription drugs more affordable. This legislation would repeal the non-interference clause and allow the federal government to negotiate directly through Medicare for lower prescription drug prices. Something that should have happened years ago. Why are we just now here? But with that is already what is already being allowed for Medicaid and the Veterans Health Administration. So we're doing this work. It's why I joined my colleague, Congresswoman Katie Porter, in writing to the FTC to urge them to investigate the insulin cartel of Eli Lilly, Sanofi, and Novo Nordisk. Now, these are companies I'm very familiar with. I've given their injections, all of theirs, to quite a few people. And so to them, for raising the prices of life-saving medications, life-saving diabetes medication. As a nurse, I've seen people ration insulin. I've seen them become amputees. I've seen them die. And much too often, the people most impacted by this broken healthcare system are Black and brown. In Congress, I will fight for a system that guarantees care to everyone, because I know that is what St. Louis needs, that is what Missouri needs, and that is what our entire nation needs. As a member of the House Oversight and the Judiciary Committees, I will continue to use my perch to amplify the needs of everyday people, to break them up and end the corporate consolidation that has led far too many people to struggle to find adequate care. We literally cannot afford to allow the power to reside in the hands of corporate monopolies. It's time we return that power back to where it belongs, to the people, to our healthcare workers, and to our communities. So today's conversation on the need for health equity and justice is a timely one. It's a conversation that we must continue to have until every single person is guaranteed comprehensive health care in this country. I applaud everyone in this room for showing up, for speaking up, and supporting this movement for guaranteed health care. Thank you.
Thank you so much, Congresswoman Bush. I don't think that we could imagine a stronger beginning to this event. I also cannot believe that you have not hit the 3-month mark. We are also grateful for your leadership, for your district, for our country, for our own care as individuals in this country. And thank you for everything that you're doing to advance this fight in Congress. We very, very, very much appreciate it. And thanks for being here today. All right, well, first, my name is Morgan Harper. I'm a senior advisor here at the American Economic Liberties Project, and I'm also going to be moderating our first panel. As Congresswoman Bush noted in her remarks, a lot of what we're going to be talking about today has to do with COVID-19, the pandemic that we continue to live through and manage. But we also are talking about deep-seated issues that were around well before then, and that COVID has only exacerbated. So with that, I'm going to quickly introduce our panelists on our first panel to talk about how monopolies impact some of these dynamics in our healthcare system. and then let them provide a little bit more context about where they're coming from in the conversation. So first we have Jean Ross, who is a registered nurse and a president at National Nurses United, which is the largest union and professional association of registered nurses in US history. Dr. Abdul Sayed, who's a physician, epidemiologist, author of Medicare for All, A Citizen's Guide, and host of the podcast, America Dissected. So he's got a lot of free time, that's clear. And Zephyr Teachout, professor at Fordham Law School and has already been noted author of Break 'em Up, Recovering Our Freedom from Big Ag, Big Tech, and Big Money. Thanks to all of our panelists for being here today. And I'm actually going to start with Jean, if you don't mind, to just provide a little bit more context about National Nurses United and some of your views on the current state of affairs with COVID in our healthcare system.
Sure. As you said, I'm a registered nurse. I've been one for over 46 years. Very pleased to be on this panel today talking about healthcare monopolies. What's going on right now, I know whenever I talk to reporters, I tell them we were stuck in this pandemic starting from behind. And the reason we do is that the healthcare corporations, monopolies across this country, have run whatever we had for a healthcare system into the ground. Everything is for profit, and it doesn't matter what your tax status is. It really doesn't. It's always the bottom line. So when you're always looking at the bottom line, you're looking at, what do I need right this minute for staffing? What do I need right this minute for supplies? So here comes along a pandemic, and we are stuck with what we've done for decades, fighting for the staff we need, fighting for the supplies we need, and you're in the midst of this pandemic that we haven't seen for centuries. So that's what's led us up to doing what we've always done, speaking up for our patients and for ourselves. And to that end, we have had to do all kinds of, we've done over 2,000 protests across the country, trying to get to a place where everybody understands and bands together with us to do the kind of solidarity that we need to change the dynamics right now and to hopefully change forever this monopolistic system that we've got.
Thank you, Jean. And Dr. Sayed, if you want to give a few opening thoughts.
Yeah, first, just really honored to be here with folks who've been a long time in the fight, folks who are serving on the front lines like Jean, and my good friend Zephyr, who wrote an excellent book I recommend everybody read. And then, of course, your work, Morgan, and the work at the project. Thank you, and Representative Bush, thank you for fighting the good fight always for us. I just want to, quickly step back and explain to folks the dynamics underneath the hood of healthcare and the way that corporate consolidation, both by insurers and by healthcare providers, squeezes out the patient. It's on vogue for people to think about themselves as consumers of healthcare, as if we're some kind of customer. But that's not really how it works. So if you imagine on one side you have insurers and on the other side you have healthcare providers, what happens is that if you're lucky enough, if you're so privileged, in the middle here, there's you. And you pay every 2 weeks alongside your employer to have health insurance. And then if you were to get sick, you go to a provider to get health care. Now, here's the thing. If you were a customer, you would directly pay for the health care that you got. That's how being a customer works. If you go to a market and you want to buy some tomatoes, you pick out the tomatoes you want, you buy them, you literally hand over the cash for those tomatoes to the person who's selling them. But in this circumstance, what happens is when you in the middle get sick, right, and you go to a doctor to get care, what happens is that you become the reason a financial transaction happens between an insurer and a provider. You're actually not the customer. You're the product, right? Because those tomatoes in that example that I just showed you, they're the reason a financial transaction happens between you, the customer, and the seller of those tomatoes. And what's happening right now is those prices that are transmitted between a provider and a payer, they're negotiated in ways that are all about trying to outcompete everybody in your parallel, right? So if you're a hospital, you want to outcompete the other hospitals. And if you are an insurer, you want to outcompete the other insurers. And so you're negotiating prices in ways that make sure that you have access to the biggest folks. And so if you're a hospital, your goal is to get the best prices for care, right? And then outcompete the other hospitals and buy them up. That is how corporate consolidation happens in the healthcare system. And guess what? that means that you have no say in the prices. You can't shop for prices. Those prices are dictated based on the size of the corporations that you are beholden to, because of course you're only going to get healthcare in a place that's close to you. So I wanted folks to understand that, because this is raising the prices for people. It's limiting our abilities to have choices in the healthcare that we get, and ultimately it's a big reason why so many people are locked out of the system.
Thank you. And I think that context is important, because for a lot of folks, we're getting the care, but we don't really understand the dynamics behind. So that's important level setting. And Zephyr, if you wanted to provide a couple opening remarks.
Hi, thank you for having me. What an amazing panel. I am so excited to be here with all of you and talking about something that is absolutely urgent. And thank you for that context. I highly recommend his book as well. You've got to read it. I can see it in the back of your panel. So I was looking for my copy to hold up. It's fantastic. Two brief things before we get into a conversation. First, I just want to be clear for anybody who's watching. As far as I'm concerned, we desperately need Medicare for all. When I am talking about, and I've been very clear about that throughout, what I am talking about when we're talking about busting up monopolies in the healthcare system is the fact that even with Medicare for all, there's extraordinary concentration in so many different areas of the healthcare industry that is, among other things, depressing nurses' wages and treatment on the job, degrading work quality, degrading our health quality, increasing prices, and leading to an incredibly fragile system, as Jean was talking about, that led us to a position we were absolutely not ready for this pandemic. So just as a few examples, if you look at dialysis centers, there's two companies that control 96% of the market. If you look at syringe manufacturing, there's two companies that control nearly 70% of the market. If you look at IV solutions, there's two companies that control 70% of the market. And then when this pandemic came around, we turned around and saw that the ventilator market was totally controlled after Covidien merged with Newport, leading us in an incredibly deadly situation that led to many people's deaths, because we had such incredible concentration and fragility in these markets. And by the way, when Covidien bought Newport, that should have been a clear antitrust violation, but we've had 40 years of antitrust enforcers who have been asleep on the job, and an antitrust ideology, which is the market is going to work it out. And we can look at area after area in healthcare where it hasn't worked it out.
Thanks, Zephyr. And we do want to make clear just like what this impact has looked like. And so I'm going to come back to Dr. El-Sayed to just provide a little more context about, something that's been referenced. It's a racial justice issue. It's been a worse impact for Black and Brown communities, rural communities. But can you speak a little bit about what about this dynamic makes it worse specifically in these communities or in these types of geographic areas?
Yeah. What corporate consolidation is in effect doing is it's concentrating more and more of the power and the decision-making in hospitals in further and further locales that could care less about any one hospital. When the Catholic sisters down the street used to run the hospital in the local community, they did that not because they were looking to make a payout. They did that because they cared about the local community. But as those smaller hospitals get bought up, what tends to happen is decisions are just made on a bottom line. We're seeing hospitals get bought up by other hospitals or private equity firms, and they're just making bottom line decisions. Now, here's the thing. Because we don't have insurance that treats everybody's body as equal, because there are differences in the reimbursements among low-income folks and high-income folks, and low-income folks tend to be poor and Black in urban communities or poor and white in rural communities. What tends to happen then is that your body, as a function of where you live and who you are, does not command the same reimbursement to a hospital. And so the incentive to care for that body goes down. Now, here's the thing. if you're thinking about the role of segregation and or rural communities in reducing the density of people, and if you think about the impact of that kind of concentration, what tends to happen is urban communities and or rural communities don't have hospitals that earn the same bottom line because of the way that we systematically reimburse lower income folks lowest. So if you're uninsured, there's no reimbursement coming for you. If you're on Medicaid, that reimbursement is notoriously low. And so what happens is that as you have consolidation in the system, these rural hospitals or urban hospitals get bought up by these big corporate for-profit chains. And then those chains make a decision that it's not worth keeping them open, so they shut them down. And we lose the whole goal of providing healthcare in the first place. That hospital that may have started as a Catholic hospital or a Presbyterian hospital or a Jewish hospital, right, for the purpose of taking care of the community, and then it gets bought up by someone who only cares about what the bottom line is, they have no incentive to keep it open, so they shut it down. What then happens is you end up having in urban communities hospitals that are either disinvested in or hospitals that are shutting down that used to serve predominantly low-income people in those communities. And in rural communities, you've got folks who are having to travel 3, 4, 5 hours sometimes to get healthcare because all of the whole local hospitals close to them shut down. It's a math problem. If you have people who are far apart and each of whom doesn't get reimbursed the same way, in the end, the ability to sustain a hospital on a bottom line for-profit system, it becomes incredibly weak and those hospitals shut down. And so it's important for folks to understand that the system that we have right now, in part because of corporate consolidation, in part because we don't have a universal insurance system that treats everybody's body like it's equal, ends up disinvesting in and ultimately shutting down hospitals that serve the lowest income people, be they rural or be they urban.
Thanks, Doctor. And then Jean, if you could just talk a little bit about in these different contexts, what has been the experience of your members and nurses around the country during the pandemic and before, and how that plays out as a worker and the experiences that people are having?
Well, some of what I would say, I think Congresswoman Bush already said, and it's very, very true. What we end up seeing is what we hear from our members, yes, as nurses. But mostly what we see and feel is what's happening to our patients and their families. So when the doctor was talking about, and Congresswoman Bush, the healthcare deserts, closing down hospitals and having to go further and further and further away. And trust me, I have had 6 children in my life, and I had to run by the last one. I couldn't have been 40 minutes away, let alone 4 hours away. Those things are meaningful and they impact our society. That's something that needs to change. One of the things that we see in our patients and we hear from our members is what we do for a living is not just undervalued. And even with the pandemic, we are glad that what we do is brought to the forefront, but look at it. It's not just healthcare, it's just care, period. Whether you're a child care worker, a teacher, a nurse, it doesn't matter. Anything that you do that requires care and service is undervalued in this country. It just is. And that's why we find ourselves in a place like this. I talked about the number of protests that we've done across the country. Many of them have been, please keep this hospital open. Please keep this community hospital open. And we've had some success, but it's getting harder and harder. And there are fewer of them because of the monopolies. We see patients who should have come in a long time ago, and they just didn't. It's not because they didn't know they were ill. It's because they couldn't afford it. And many, many of them have quote unquote insurance. So they end up in our emergency rooms. And they go right to intensive care if we are able to save them at all. And with a pandemic, all the while that they have been waiting and trying to tough it out because they don't want to bankrupt their families, all the while they are spreading, possibly shedding virus. So it hurts all of us so much. But from a nursing perspective, it is really hard to see. One of the many things that's given me, I said I've been a nurse for over 46 years, is I've seen the difference. I've seen the difference in when your employer your immediate supervisor used to listen to the input, the professional judgment of a nurse, the professional judgment of a physician. That's all changed now. And it hasn't done us any good. It's really, really harmed us. So there's been a huge, huge change, and nothing is for the better.
Thanks for those comments, Jean. And Zephyr, I know you already referenced a little bit about, some examples of monopolies, some examples of missed opportunities where there could have been federal intervention to stop some of this. Wanted to see if you had more to add there about just the role of monopolies in some of these dynamics for both patients and workers, and what can be done, with a renewed sense of our antitrust authority.
Yeah, I mean, just to build on what the doctor and Jean were saying, and then talk about what could be done. We are talking about companies like HCA, which own 180 different hospitals, or Common Spirit Health, 150 different hospitals, 700 different sites around the country. They are closing down sites. They are themselves making outsized profits. HCA made billions more than it was supposed to last year. So they're making these profits, and they are leading to raised prices. So there's very good evidence that when it comes to hospitals in concentrated markets, the costs are 15 to 20% higher than in markets where there are multiple hospitals. Also, by the way, the wages of nurses are lower when you have basically one place to work and a hospital chain that is concentrating across the board, and they aren't negotiating for decent benefits and decent care, which then affects quality of care. So there's also evidence that consolidation affects quality of care. And so what these hospitals do, closing down in areas which they see as not profitable, so there's total deserts, ramping up prices in other areas, treating workers badly, degrading care. All of those things are very serious problems that we can deal with through regulation, yes, but if we actually have, one, Medicare for all, and two, a more decentralized hospital systems, the federal government stepping in to stop those mergers instead of allow those mergers, requiring more decentralization, requiring regional hospitals and regional competition. Those things both together are important, because once we have Medicare for all, we still don't want them negotiating with a hospital who's like, hey, we get to set the price because we're the only hospital in town and we're controlling the market. And that, I think I just want to dwell on that for a minute, because I think it's really important to understand. And somebody in the comments asked what the vision is. And people will have variations of a vision. But the vision is an active FTC, an active DOJ acting to block these mergers instead of waving them through. I mean, we have courts, and we're going to need some legislative change. We have courts that say, oh, it's not concentrated because people came to this hospital from somewhere else several hours away. Sort of using a really, again, the market's going to figure it out approach, instead of understanding, no, this is an area where we really need to protect a dynamic and decentralized market for those areas that we don't take federal responsibility for. And just very briefly, we're talking about hospitals. I talked about some other medical areas. We got to talk about pharma. I mean, if you wanted to come up with an industry that is sort of the inverse of a moral caring industry, it's just this deadly, greedy, selfish, law-breaking industry, big pharma, that accepts litigation as the cost of doing business. We have had and allowed an enormous number of mergers in pharma. And as a result, we are seeing fewer innovative drugs coming to the market. Basically, these big pharma companies are firing the chemists and hiring accountants to figure out how they can squeeze more dollars out of you. And it is killing people. So there's a lot of different ideas about the way the federal government can and should deal with patent reform and evergreening reform. All of those are important. But what you don't want is you don't want Pfizer and its two buddies to be controlling the private market. So a sort of core anti-monopoly principle is the one thing you don't want is a private for-profit industries governing essential parts of an economy. So you either nationalize or you decentralize. And typically, and people often think of it as one or the other, but I think something that's really important to get across is I believe we should be doing both. So we fully embrace Medicare for all and take on big pharma by making sure that we don't allow Pfizer to keep gobbling up companies, more decentralization in these other areas. And we know that if we don't do that, they're going to keep winking and nodding at each other. We've seen generic prices rise up as long as it's in a concentrated market. So generic isn't the solution. We need federal insurance and really addressing the hospital problem and the device problem and pharma.
Yeah, no short list of areas to address. So, and actually, this is sort of for the whole panel, but maybe I'll start with you, Dr. Syed. Because we've seen, and has been referenced so far in your all's comments about the raised awareness because of COVID, during COVID, more organizing that Jean's referencing, that the union's doing. Do you all feel like a year or so into this that we're in a better position to be addressing some of these core issues in the healthcare industry and our healthcare system? Why not? And what are some of the organizing challenges there?
I certainly hope so. And if so, it's because people are starting to see themselves in the broader morass of the broken healthcare system and asking, why is this happening? Here's the thing, though, is that there is a lot of power on the other side of these debates. And, you're seeing the corporations flex their muscles in ways that really, I hate to say it, but are building the reputations rather than demonstrating the ways that they are profiting off of the public good. And here's a perfect example of it: the vaccines. Right, the vaccines are a function of deep levels of public investment, and the fact that the hardest part hasn't been developing them, but has been deploying them, is a function of the fact that because we spend so much money in our healthcare system paying these major corporations, we don't have enough to invest in basic public health goods and services. And so the challenge, though, right, is that even as, the Moderna vaccine, for example, was built out of research from NIH laboratories, not just NIH funded laboratories, NIH laboratories themselves. And that recipe was in effect handed off to a corporation that spun out of a government grant, right? Mode RNA, right? That to make RNA vaccines. What's happening is that company, right? That for-profit entity is taking all the credit. Same with Pfizer and BioNTech. Same with Johnson and Johnson. And so the full story of the public in the public-private partnership isn't being told, and people are resting all of the accolades at the feet of these major corporations who basically took government money and were able to, do the part that they were supposed to do. But ultimately, our lack of investment in the system left us from being able to deploy them as fast as we needed to. And so I worry, right, that, in a lot of ways, once you are as big and powerful as these corporations are, you can almost always use a narrative to launder your reputation. And that's exactly what they're doing right now, rather than the fuller, bigger story being told. Same way, you see advertisements from major corporate hospital chains taking credit for the heroic efforts that nurses and frontline healthcare workers and doctors are putting forward every single day, often in very challenging circumstances because of the greed of those hospitals. And yet, they're the ones who are putting ads forward and talking about how they've been the heroes of COVID all along. And so, there is a responsibility for all of us who understand the structure and system underneath our healthcare in this country to make sure that we set the record straight on the narrative about how corporations have left us behind and about how we're more poorly served because of it, and the amazing role that government served in both research and developing the vaccine and ultimately deploying the vaccine within any credible period of time.
Thank you. And Jean, same question to you. And also, just in terms of as a union, what's been the response of your membership, expansion of that, and some of the dynamics in trying to implement these negotiations for your workers?
Mm-hmm. Well, I think unions right now are more popular than they've been in, say, 50 years, partly just because of people being aware now of what it takes to stand up for yourself in the workplace. So that goes for us in healthcare. Nurses are, coming out of the woodwork, asking for representation, help us organize. But I think you saw it in meat packing, you saw it in the grocery stores, et cetera. People who have never known union or have always had union talked down about don't understand what it really means and what it can do for you and what it's like to have democracy in the workplace. So that's a good thing. It's brought it to the forefront. But I think, so that's one of the reasons we're so supportive of the PRO Act, because that will give us what we know you get with a union contract, which is to be able to speak up for yourselves, just as nurses need it to speak up for themselves and their patients, teachers need it, the public need it. No matter what you do for a living, you are faced with this onslaught from the employer, who never has any money, of course. They never have any money, but they seem to find the money for captive audience meetings and these lucratively priced consultants to teach you as an employee how you don't really want a union. And by the way, let's talk about what we're going to threaten to do to you if you dare to even try to form one. The law makes no difference. They do it anyway. So one of the things we do as unions, obviously, is organize. When I say organize, I don't mean just organize future members into our union, but I organize the public. What we've gotten when we want support for keeping a community hospital open, it isn't just our members, it's the community. What we've gotten when we protest that we don't have enough PPE, this OSHA temporary emergency standard on infectious diseases, which will keep us safe in order to keep the patients safe, that we get from organized support to help us get what we need. So we need all kinds of folks doing that organizing, the kind that we do. And what I found across the country, what we've found, is that people want to help. They really do. They're just looking for an avenue, and they're looking for someone to instruct them as to how they can help. So to that end, we have people phone banking, we have people doing car caravans, saying, it isn't just these people in this union that want things. We need it too. We agree with the nurses. We agree with the doctors and the teachers. We need that desperately. So those are the kinds of things we can be doing now while we're advocating for Medicare for all, which we desperately need.
Thank you, Jean. And yeah, Zephyr, same question to you. And also, if anything you wanted to add about priority fights right now, given the political state of affairs.
Oof. Well, the PRO Act, that is a priority right now. Look, we are clearly at this critical moment where you have an incredible anti-democratic push on the one side and an incredible pro-democratic push on the other. And it is like, the next couple of years will matter enormously. Protecting the right to organize is absolutely essential. I think of it this way, that unions are essential for protecting dignity, protecting the right to organize, giving a chance for people to come together. The essential tool for people to come together, and antitrust is the essential tool to break up the ability of capital to come together to oppress us. So that unionization and antitrust, supporting unionization and pushing for a strong Biden administration that's actually going to, for the first time in 40 years, enforce our antitrust laws in a serious way, both of those two fit together as shared priorities. What that means is telling Biden, for instance, bring a strong AAG of antitrust. We don't want somebody who's going to continue, not just continue Trump, but continue any of the last 40 years, including the Obama era, was not good on antitrust. Like, let's look at the number of mergers that we saw, that we've seen since 2008. We really got to the great bed shed, as they call it, the loss of hospital beds, the creation of these deserts. We need a total turnaround from the Reagan era that we're still living in, that started in 1980, when it comes to anti-monopoly law. And the energy is there, but as Dr. El-Sayed said, they are pushing back and they are trying to take credit for everything. And this goes to the last reason why anti-monopoly is such an important piece of this. There are multiple important pieces, but anti-monopoly is an important piece because we need to change the way we fund elections. Believe me, we need to pass S1 and change how we fund elections, but we got to go at the root of corporate abusive power. The reason they are in a position where they can just set the terms for your pharmaceuticals, jacking up the prices in abusive and deadly ways when it comes to insulin or EpiPen, is because we have allowed them to basically take a kind of governing power. So we've got to go right at the root of their power, protest their policies, but also say, hey, this is illegitimate to allow this much concentrated private power over something so precious as our bodies and our health.
Well, we hit time unexpectedly, but I really want to thank all of our panelists for your comments and really breaking it down to the core issues and also touching on some of the ways in which all of us, I think this is a really important point, that all of us have a role in organizing around these issues, whether or not we work directly in the healthcare industry or not. And it's about protecting our health and our larger communities at the same time. So thank you to our panelists. And with that, I'm going to transfer it over to George Gale, Director of People's Action, to lead our second session.
Hey, thanks, Morgan. Great to be doing this with you. Hey, everybody. My name is George Gale. I'm the Director of People's Action. We're a grassroots organization of low-income and working-class people in urban, suburban, and rural communities across the country. And in this next panel, we're really going to try to focus even more on solutions. And we've got a great group with us. So I'm just going to introduce the group, and then I'm going to move the first question to Mike. So Lisa Frank is Executive Vice President of Director of Strategic Campaigns for SEIU Pennsylvania. For those that don't know, SEIU is one of the largest labor unions in the country with 2 million members in healthcare, the public sector, and building services. We have Olivia Webb. Olivia is a policy analyst with the American Economic Liberties Project, the co-host of our event today, and Mike Bowen. Mike is Executive Vice President with Prestige Ameritech. Prestige Ameritech is the largest domestic manufacturer of surgical masks and respirators in the U.S. Mike, early in the pandemic especially, we were dealing with a huge crisis in terms of limited PPE supply. One way I experienced that was in our organization. Retired folks, especially in the South and in rural areas, had to take it upon themselves and started sewing masks by hand. And then younger folks would deliver those masks to workers on the front lines in communities where PPE just wasn't showing up. And while we appreciate this kind of uniting and coming together as a community, it also spoke to something deeply broken. You testified before Congress last year about some of the challenges businesses faced in producing PPE. And it's hardly the first time you've raised these questions. You've been sounding the alarm as far back as 2007. Can you talk a little bit about the mask market in particular and the ways you've had to deal with monopolies in your business and the changes you want to see the government make to address these challenges? I'm going to turn it to you, Mike.
Sure. In about 2003, America made about 90% of its masks and respirators. By 2005, America imported 90% of its masks and respirators. In 2006, my company began as former employees of a mask market leader that in the 90s sold to a multinational. And then that multinational and all of the other large mask makers in America left the country at the same time to do two things: to win group purchasing organization contracts because they are let and they're won by low price. So they left the country for lower labor and to pay their employees less, make more profit. So a bunch of former employees of this mask market leader from the 90s called Technol started our company in Texas. And we were very naive. We thought, well, we're going to warn the country that America's mask supply will collapse in a pandemic. And all you need to do is buy American-made products. And that didn't work. Nobody listened. It was so bad that even though the government, HHS, agreed with us and agreed to back up our warning, we couldn't even get hospitals to call HHS to verify the warning. So for 13 years, our warnings were unheeded. And ironically, the companies that caused the problem are the companies that are most benefiting from government contracts and from COVID. We were the largest U.S. mask maker when COVID started, and we have probably the smallest contract. To give you an example, Medline is a $10, $15 billion company that led the charge to take products to China. Yet recently, after COVID, they got a DoD contract to put a mask company in Georgia, I think. So again, the people who caused the issue were rewarded. And we struggled along for a long time, trying to grow. And the problem with trying to grow, the monopolistic situation that we encountered was called, or is called, group purchasing organizations. Every hospital belongs to at least one, and they bid out products, and they expect the companies that bid to have sales reps and clinicians in every state. Well, that's impossible for a small company. So it inhibits the growth of small companies. I'll say one more thing. In the 80s, when I got into this business, a few people could get together, raise some money, come out with a new product, and gain business one hospital at a time. That's impossible now because the hospital will say, you can't even come in here and sell your product. You don't have a group contract. Well, to get a group contract, you got to have a national sales force. You got to have clinicians all over the place. That doesn't happen. So the big companies continue to profit. Big companies, we need big companies. We need companies with billions of dollars of resources to be able to develop drugs and things, but not at the expense of little companies.
Mike, what's one solution? What's one solution to the specific issues you guys have faced?
I don't know. We're just a little Texas mask company. We don't have a government department. We don't have lobbyists. We're just people out trying to do the right thing.
Yeah, that's great. Thanks for sharing that. Next,
we put our company in Texas after everybody else had left. Some people call us the last mask company. No, we're the first mask company after everybody else left.
Yeah, thanks for sharing that. I'm going to turn it to Lisa. Lisa, like you, I'm an organizer, and as organizers, we're always trying to find handles, like strategic ways to intervene in a challenge and turn it into a win and tangible improvement in people's lives. And we have these clear North Stars that have been talked about earlier, but people are suffering, and we got to be winning. And I sense from our conversations there are really tangible organizing handles we could be working on right now, and that you're doing that in Pennsylvania. And love for you to share for us some ways we could intervene, improve people's lives, improve health outcomes, and win in the near future.
Yeah, thanks. I think the concept that we try to focus on when we're thinking about, what strategy could we think of here, or what tactics could we think of here, really is accountability. I mean, you're talking about monopoly. You're really talking about power. It's not a thing. It's a set of power relationships, and those power relationships are governing how. Not just commanding price, which a lot of economists have talked about with healthcare monopoly, but how and when are resources spent, and which kind of healthcare are we building out and which kinds are we not? What's being prioritized with our resources, what not? And then also some of the things that Mike's talking about. Monopoly doesn't just happen on the we make a product side or we make a service side, but it's also, monopolies are purchasers, and they restrict whose companies get things purchased from them. And of course, when we're talking about workers, which we're talking about, that's control of labor market. So there's monopoly, and then of course the kind of flip side of monopoly is monopsony, right? So, but it's all power relationships, and so all of the strategies and tactics that we try to think of are how do we relieve the immediate pain that people are feeling at the same time that we try to structure a little more accountability, right? The cure to monopoly or monopsony is democracy. So how do we do that? And I think people's instincts around it are pretty good, right? People kind of instinctively know that if you're the kind of Lilliputians and here's Gulliver, that getting together is a good thing to do. And we can get together in a lot of different ways. We can get together at legislation. And I think a lot of people, me included, are looking at a really interesting bill that's in New York right now, Senate Bill 933, which is called something like the 21st Century Antitrust Act. I've not got the name quite right, but it's really looking to make the regulation of and to give really relief, injunctive power, so that people who are not, their business isn't able to prosper, or they are not able to speak out on the job, or the various ways in which they're being oppressed by too much power can be relieved by using government, which is kind of a good tool in democracy. So there's legislative things. There's things that government does all day, every day, issues contracts, right? Everybody's state regulates nursing homes and hospitals through, just straight up regulatory processes. How could we use those everyday activities to also do something about the power of these providers? Could we, I'm thinking about Mike a lot now because you just spoke, but if we're doing Medicaid managed care contracts, let's say, could we have a provision that says, well, look, network adequacy means including small businesses. If you want this contract, you have to figure out how to include some innovators in the market who are able to do something in a low cost, effective, high quality way. So I guess that's one solution is really kind of digging in to see the nuts and bolts of government. And we're late to that. I mean, we know that the providers have done that for years and years and years. Most of these regulatory systems have been deeply influenced by providers, and we have to kind of re-influence them in the direction of human beings. Attorneys general, somebody has mentioned, have tremendous and broad power over healthcare, over charities. Most care in Pennsylvania is provided by not-for-profit institutions, charities under Pennsylvania law. And consumer protection. Takes a lot of education to help attorneys general to kind of see things this way. They tend to want to stick workers over into the labor department, and they tend to want to, not sort of see the intersections. But lots of us have very, very bright attorneys general who do, and in our case in Pennsylvania, really did step up to protect hundreds of thousands of patients who are going to get booted from their hospitals and have their connections with their providers severed. And, through people speaking out and protesting and doing that education, really got to win. People have used community benefits agreements. At a local level, somebody needs to build something, there's a planning process. There are just all kinds of processes to try to intervene in to, again, assert the priorities of regular people in the provision of healthcare, in the pricing of healthcare, in the purchasing of products like masks, or in the hiring of workers. And then finally, lots of people have mentioned it, but I think unions are incredibly important. I'm not aware of a single antitrust case that has ever been undertaken on behalf of unions, but there's no reason not to. I mean, there's just no reason not to. Monopsony is every bit as real as monopoly. And I think it's a particularly important in healthcare. This is something that Jean mentioned. Healthcare is not a place where you want people afraid for their jobs. So if you're a nurse and you trained and you paid to train, and this is your profession, and you live in an area where there is only one hospital system or one provider, and you object to something or organize your coworkers to object to something, and you're terminated, or you're a doctor with a non-compete clause, right? That's it. That's you're talk about exit. If you use your voice and instead exit, that means, moving somewhere, uprooting your whole family. The penalties to workers for not going along in monopoly conditions can be really quite severe. And it's really important in healthcare that workers be able to speak their minds freely. We saw this in the pandemic. There's research that shows that union facilities did much better in the pandemic than non-union facilities. What is the reason for that? That's caregivers having a voice on the job. So those, I think, are some ways in which people are really exercising their power and beginning to take this on.
Excellent. Thank you. Olivia, so kind of maybe two questions in here one, I think if you want to cover anything that's been discussed so far, I'd love you to hit on that. But the development and rollout of the vaccine, I think, shows the opportunity for government to check monopoly power, but it also further exposes the challenges of relying on unchecked monopoly. So love to hear you talk about this dynamic and how we manage it.
Yeah, just to build off of Mike's story, because it's such a compelling we all saw the pandemic coming. And like he said, we knew that we were going to need a supply of masks. We knew we were going to need a supply of PPE. And to not be actively trying to shore up our system of that was a huge failure. Of course, we could have done this years ago if we didn't have such concentrated group purchasing organizations. Pretty sure the FTC knows about them and just has chosen not to take action. So they could. That would be awesome. But regarding the vaccines, I think this is a really cool case of seeing the power that the government has. I don't want to even call it a public-private partnership, because it was less a partnership and it was more the government saying, we need these, we will fund them, we will help you get the research, and then we're going to pay for the vaccines so that they're free for everyone. I mean, it was a mini taste of Medicare for all just in the vaccines. And we've done this in the past. We've taken emergency measures in the past. This isn't a plant, but I'm going to plug my colleague Matt Stoller's book. He talks about how during World War II, the government was forced to devolve aluminum patents from the one monopolist that had the patent to a series of different manufacturers that could also produce aluminum. And the government didn't just do this for aluminum, they also did it for, I'm quoting from his book, again, not a plant, rubber, aircraft, magnesium, aluminum, and other industries as well. They realized that they needed to have these patents and they needed to have other manufacturers, and they took strong action to get it there. And this is, we did this well. We have vaccines faster than ever before, and they're going to be free for anyone who wants them. That's amazing. The part that we failed on, and Dr. El Sayed touched on this, is the rollout. And that's where the government decided to throw its hands in the air and say, CVS and Walgreens, you take this over. And those two big corporations don't have the incentive to do it well. And they just decided not to. Meanwhile, West Virginia and South Dakota, two states that have a strong network of independent pharmacies, took the lead really early on getting their vaccines out to people who need them. So that's a part where the government could have said, we should be investing in public health infrastructure for years. But given that we haven't done that, now it's time for us to send in FEMA, send in the National Guard. Let's partner with all of the independent pharmacies who really care about their communities. Let's get this vaccine out using strong federal power in the same way that we did for the vaccine development.
So if government got it right, at least on part of this, like what's that, looking ahead to the future, what are some other things we could do? Like if we learn a lot through crises and how we react to them, what are some future looking things we can do if government is more proactive and kind of taking the bull by the horns?
Well, I mean, the end of the line is obviously Medicare for all, but you don't have to, go all the way. It would be awesome. But you could do insulin for all. You could do EpiPens for all. Everyone who needs them, this is accessible. The government doesn't even need to manufacture them itself. As we saw with the vaccines, the government wasn't manufacturing. I mean, I'm into it, but they didn't have to. They could just take action and say, you need to produce this at an affordable price and with wide enough distribution that people aren't dying for want of vaccine or insulin or EpiPens.
Yeah, that's great. Thank you, Olivia. This is a question I'd love to hear from all of you or whoever wants to take it. Just if you could, to some extent, if you could wave a magic wand on some next steps, like what do you see as areas where we can address monopoly power in the healthcare sector, and where we think we can actually bring together big groups of people and maybe diverse constituencies that have an interest in moving that? Because one of the things I experience in our organization is like, there's not a lot of folks that love monopolies. Like, I think people are like, it's an issue, is like kind of a broad-based issue that I think crosses in many ways partisanship, geography, race. And in a moment where we don't agree on a lot, we might be able to agree on this. So areas where we think we could unite a lot of people and have impact in people's lives. Anybody want to volunteer to go first? Or?
I think Lisa and Mike both brought up really good examples. Our hospital supply chain, both in who's producing the supplies and in the distributors for the supplies. And then, who's receiving the supplies. Hospitals are also extremely concentrated. And this has really big effects on our national security, on our readiness, on, how we handled the pandemic. And as Representative Bush mentioned, and as I think is obvious to everyone who's paying attention, this really affected Black and Brown communities. You can really unite a lot of people behind wanting racial equity and wanting just equity, period, for people who need medical care.
Mike, you'd like to weigh in on this?
Well, my world is masks and respirators. The big problem in that world has been that hospitals consider them commodities, not the life-saving devices that they are. I think the government could really help the situation by declaring America's dependence on foreign-made PPE as a national security threat. And that way, if a hospital continues to buy and have its patients and staff rely on a shaky supply of masks and respirators, that if that supply is disrupted, they'll be subject to legal penalties. And I think if doing the right thing for the right thing's purpose doesn't work, doing it so you will stay out of court might.
Well said. Lisa.
I like where you started that question. People are perfectly aware of all of these issues. I mean, they're perfectly aware of the pocketbook issues. They're perfectly aware of the access issues. They're perfectly aware of the inequity issues. Where I live is in Pittsburgh, is a place where everybody is aware that we are, I think, second in the nation for infant and maternal mortality among, Black mothers and their infants, while we kind of sit in the shadow of a $20 billion global health enterprise. And it's really quite easy to get people to talk about it. And one of the instruments that I really like, we don't use it, it doesn't have any power in it, but hospitals here through the Affordable Care Act have to do a community health needs assessment. And it's a really kind of interesting thing where they have to sit down and say, like, who's sick around here? Why is it that a person in this zip code lives a decade less than a person in this zip code? Why? And if you could make those assessments have some bite, you would make entirely different decisions than the decisions that we see being made now. For instance, you would not close a hospital in Braddock, a poor community, where mostly people of color live, and open one 10 miles down the road in a wealthy community called Monroeville that doesn't need one. You would not build a tower to, a certain kind of destination procedure in a medically underserved area that doesn't have enough primary care physicians. And I like that because when you talk to people about it, if you just take out a community health needs assessment around a particular hospital or in a particular area and you just read it out loud to people go like, yeah, that's what I'm talking about. Hell yes. But it doesn't, it has nothing to do with corporate governance, nothing to do with reimbursement rates, nothing to do with any of the decision making. And so if I could wave a magic wand, I would make those instruments be the corporate charters of our healthcare system.
I love that. You mentioned that to me the other day. I think that's a fantastic idea. So I've got a last question here, and I don't know if everybody want to take it, but over the last 4 or 5 years, there's been like kind of a new interest in what's going on in rural communities across the country, and certainly see lots of reporting around how like consolidation, especially in the healthcare sector, has not been good for rural communities. There's no evidence that it is good. And this lines up with our experience. People's Action in 2017 went out and had 10,000 one-on-one conversations with people in rural communities on their front porches. And we asked, like, what issues are keeping you up at night? What do you see as the solutions? And why do you think things are so hard here right now? Far and away, the number one issue identified by people as keeping them up at night was healthcare. And then when we asked, like, why do you think things got the way they are? They said they feel like we have a government that is responsive to a very tiny few at the top of our economy and not responsive to so many people in the country. And people are really feeling that. We didn't lead that. 81% said that when we asked. And so just curious, like, again, in the spirit of solutions, like, what can we do to help address the kind of declining conditions and declining health outcomes in rural communities, especially as it relates to monopolies and consolidation? See you nodding, Lisa.
I don't want to take Lisa's.
Oh, Olivia, go for it.
Yeah, I don't want to take Lisa's answer. And Lisa, would love for you to dive into this deeper because it's something you've mentioned to me. Rural hospitals are also a labor issue. If you only have one hospital in a rural area, the nurses who work for that hospital are completely at the mercy of the ownership of that hospital. And so, Lisa, I would love to hear more about that. But I also think that, using the power that exists in government and in governmental agencies is crucial. Representatives and senators and, the FTC commissioners all have the power to protest or block hospital mergers and acquisitions that eventually lead to rural facilities being closed. They also have the power to fund rural facilities more so that being acquired is no longer an attractive option, that rural facility can continue to provide essential services in perpetuity.
Thanks, Olivia. Lisa or Mike? Lisa?
I did some of those door knocks too, and with George, and I think some of the even addiction and there are I think powerlessness is a health crisis. I mean that in a very direct way, not just like, well, we don't have power, so we don't elect the right representatives, so they don't regulate us in the right way. I think in the way that stress is a health issue, I think powerlessness is a health issue. And I think it shows up in the opioid crisis. And I think it shows up in a lot of places. I think it shows up in declining life expectancies in rural communities. And I think that in part because there are experiments going on where they are actually testing the health effects of a little bit of power. So they screen people and they say, do you know anybody who's got any influence? And then, of course, that correlates to your life expectancy and a bunch of other stuff. And then they are doing experiments that are just about power. They're just like, here, sit down with people in your community and here is some resource. Address the issue that you want to address. It doesn't have to be health. It could be childcare, or it could be the roads, or it could be whatever, but you've got a little power right now. And lo and behold, people's health starts to improve. I think, when we talk about healthcare facilities where workers are underpaid and overstressed and terrorized, we're talking about a healthcare system that produces ill health along with recovery. So what am I trying to say? I think we have to think of health in a much broader frame than we typically do, right? Health and healthcare is not about, here's a sick person and they go somewhere if they have access to get something. But health is about the engagement of people in the conditions of their own existence, one of which will be that narrower thing called the provision of healthcare. Am I making any sense? And so that's what I learned on those doors. Is that people are literally sick of their powerlessness. And that if we begin to address that, that will also give them the kinds of instrumental power that they need to put a check on monopoly healthcare, and the kind of union power, let's say, they need to make their healthcare job we could have such great home care jobs in rural communities, right? We could have such great community health jobs in rural communities, but to make sure that those jobs are making people well, not making people sick.
I love that. Lisa, you need to join everybody else in this panel and write a book, and it could be on power meets health. I think that's fantastic. Mike, you've got anything to add here as we wrap up?
I'm very grateful for being asked to be on this panel. I feel a little inadequate. I'm a mask maker. I don't know how to fix the healthcare system in rural communities, but I'm a very until this last administration, I was a very conservative guy, and I really understand and appreciate what everyone is saying here, and I have moved the needle way toward your position in the last few years, and healthcare is vitally important. I didn't used to believe that it should be universal. I do now. And again, I just appreciate everything I've heard, and I appreciate Cori Bush. Her talk was very moving. Thank you.
Thanks for being here, Mike, and thanks for saying that. I appreciate this panel. Thank you all so much. And with that, I'm going to pass it back to Morgan.
Thank you, George. Thank you to all of our panelists, some of whom have stuck around for this entire session. And thanks to everyone for joining. I hope that this session has made clear that healthcare consolidation, this is a problem for us as patients. This is a worker issue. This is a small business issue, a racial justice issue. But what all of these panelists have shown and all of our speakers have shown is fundamentally, this is a power issue. But the good news is that we have the power to do something about it. We are not powerless. Our government is not powerless. And when it wants to, it can address these issues, as some elements of the vaccine development and rollout make clear. We can make it universal. We can make it easy. We can protect our communities. And so that's what we want people to get from this session is we have a movement afoot. We have a lot of momentum. We want you to be a part of it. And this series will continue to be a source of information about how you can plug in to fight back against corporate power for racial and economic justice. Thank you again to Congresswoman Cori Bush for her, I agree, Mike, very moving remarks. And thank you to People's Action for being our co-host. And to all of you, continue to follow us on Twitter, economicliberties.us, and we'll be back in touch soon with more information. Thank you.